Thank everyone for being here today. I hope our members enjoyed and our staff the particularly long district work period. Over the last 6 weeks, I have heard a lot from my constituents about the issues that impact their everyday lives. High gas prices, housing and utility costs, food inflation, and fears of an economic downturn all top the list and give working Americans a real concern about their economic insecurity. With costs for everything rising under the policies of the Biden-Harris administration, it's important for Congress to look at ways to lower costs for American families. With constituent concerns top of mind, we meet today to discuss the bedrock law that helps provide economic security, stability, and protection to a majority of the people we serve because it protects employee benefits. Specifically, we will discuss the value of employer-sponsored health care benefits under the Employment Retirement Income Security Act of 1974, or ERISA. In the 50 years that ERISA has been the law of the land, it has helped incentivize employers to offer health care benefits that cover over 153 million Americans, or roughly half the population. ERISA works because of its preemption clause. As a conservative, you won't often hear me say I support federal preemption of state law, but in this instance, ERISA's effect is to alleviate the burden of government on employers, which actually helps workers. Without ERISA preemption of state law, the patchwork of state regulations would hamper a business's ability to offer uniform coverage options. Imagine being relocated within the same company to a different state, that happened to me several times, and having to navigate an entire new system of healthcare regulations. Thanks to ERISA, we can avoid that disaster. Employers can simply comply with the protections outlined in ERISA and provide health care to employees around the country. According to a Society for Human Resources Management survey, 90% of workers consider health care to be an extremely important or very important benefit. Another survey by Protecting Americans Coverage Together found that 93% of Americans are satisfied with their employer-sponsored coverage. With stats like that, it seems hard to believe that there are politicians who want to dismantle ERISA in favor of government-run health care. But private health insurance is at risk due to the push of the left for Medicare for all. The Biden-Harris administration wants to make private health care unaffordable and unattainable so that Americans think they have no choice but to support government-run plans. They have saddled employer-sponsored health care with more regulations and have removed viable coverage options like association health plans and short-term limited duration plans. The Democrats' misnamed Inflation Reduction Act shifted billions of Medicare dollars to fund failing Obamacare plans. Now Democrats plan to extend expanded premium tax credits beyond 2025 at a cost of $335 billion. I don't think they understand that using tax dollars to pay for certain Americans' monthly health care costs is robbing Peter to pay Paul and actually makes health care less affordable for everyone. It costs the government over $1,000 more per patient per year to place someone on an Obamacare plan than on an employer-sponsored insurance plan. Beyond Obamacare, the proposals from this administration and Democrat nominee Kamala Harris are somehow even more radical. Vice President Harris has explicitly endorsed Medicare for All, a plan which calls for the elimination of private health insurance. This would prevent over half of America from keeping the plans they have now and that they overwhelmingly prefer. A single-payer system would mark the end of ERISA as we know it and cost taxpayers an estimated $32 trillion. Worse, her plan provides taxpayer-funded health care for illegal immigrants. If the government has any legitimate responsibility in health care, it should at least be to benefit its own citizens. Before I close, I want to take a moment to play a video from the Washington Post that highlights just how real this threat to ERISA is.
I intend to co-sponsor the Medicaid for All bill. And because it's just the right thing to do. I'm proud to co-sponsor it. It is about saying that this is about a right not about a privilege for a few. You don't have to go through the process of going through an insurance company. Let's eliminate all of that.
Medicare for All would effectively eliminate private insurance. It would essentially phase out private insurance companies
As the main source, but there would still be supplemental. There'd still be access to supplemental.
Okay.
It was in the context of saying, let's get rid of all the bureaucracy. Let's get all of the ways.
Oh, not the insurance companies.
No, that's not what I meant. I support Medicare for All. It is my preferred
As a
policy.
principle, you mean, not Bernie Sanders' bill.
I support the bill.
Okay.
I support the bill.
Because the bill gets rid of private insurance for everything that
It doesn't
is
get rid of
for-
supplemental insurance.
Right, for cosmetic surgery, but for all.
Mr.
Chairman,
Get rid
point
of
of
all
order,
the
please.
Who here would abolish their private health insurance in favor of a government-run plan? All right.
Do you believe that private insurance should be eliminated in this country?
No.
You don't?
No, I do
But
not.
you raised your hand last
But
night.
the question was, would you give up your private insurance for that option? And I said yes.
My plan will separate your health care
Mr.
from your
Chairman, point of
employer.
order, please.
Meaning your employer will no longer
Pardon?
dictate the kind of health care you receive. Under my plan of Medicare for All, private insurance companies will be able to provide coverage if they play by our rules.
Thank you to our staff. It's interesting, we just had the vice president in her own words without any commentary. And for some reason, some members didn't want anybody to hear that. It's very interesting.
Okay.
She says...
Point of order,
she
please.
A gentleman's not recognized. She says, under my plan of Medicare for All, private insurance companies will be able to provide coverage if they play by our rules. Although she tries to moderate and disguise her position by acting like private insurance companies can keep functioning as normal, does anyone really think they will get better health care when they're playing by Kamala Harris's rules? The Democrat plan is to make private health care unaffordable and ultimately non-existent. One way to do this is to provide artificially and temporarily lower cost government-provided health care to drive private providers out of the market. But everything the government does ultimately costs more, especially with the initial cost of the exploding debt that causes higher taxes and higher inflation. Every government expenditure either causes higher taxes, higher inflation, or debt exploding for the taxpayer. At a time when many Americans are living paycheck to paycheck and personal savings rates are near historic lows, rising health care costs are driven by government interventions are unmanageable. Permitting ERISA plans room to expand and innovate is the solution. Now it's time for Congress to work to strengthen ERISA and employer-sponsored health benefits for the next 50 years and beyond. With that, I now yield to the ranking member for his opening statement.